Serous membrane, as I mentioned earlier, is the membrane that is located deep to fibrous pericardium. It has two layers, a parietal layer that lines the inner surface of the tough outer fibrous pericardium, whereas visceral layer lines the surface of the heart. And between these two layers lies the cavity, which is called pericardial cavity, filled with pericardial fluid that is secreted by the mesothelial cells lining the serous membrane. Hence, that is parietal and visceral layers. So, what is the significance of these two layers? These two layers, they become very important because they provide or they form two passageways around the great vessels of the heart. These passageways are named as transverse sinus and oblique sinus. They have clinical significance. This is why they become another important question related with the pericardium, often given in the SAQs. So what are these sinuses? What is a sinus? Sinus is a passageway, a tunnel, a passageway having two ends. So there is a transverse sinus and oblique sinus. What are these? How are they formed? They are basically the reflections of the, especially the visceral layer of peritoneum, or in this case, pericardium, around the great vessels of the heart. How? Let's see. This is the heart, and these are the great vessels emerging or exiting the or entering the heart. Transverse sinus is a passageway that is formed within the pericardial cavity and is formed by the reflection of the visceral pericardium over the posterior surface of the pulmonary trunk and aorta and anterior surface of the superior vena cava and pulmonary veins. Here, this dotted finger is shown. The dots mean the finger, that is the index finger, is going behind the aorta and pulmonary trunk and in front of the pulmonary veins and superior vena cava. Similarly, oblique sinus is located at the posterior aspect of the heart, that is over the left atrium of the heart. So oblique sinus is a sinus or passageway located or formed in the pericardial cavity posterior to left atrium of the heart. Hence, it is located over the posterior aspect of the heart. So, transverse sinus, it is a horizontal gap between the arterial ends of the heart tubes in front. That is, what arterial ends? Anteriorly, pulmonary trunk and aorta, and venous ends behind. What venous ends? The pulmonary veins and superior inferior vena cava. So I hope, and especially particularly the superior vena cava. On each side, it opens into the pericardial cavity. Hence, it is basically located inside the pericardial cavity. So I hope these points are clear to you. So oblique sinus is the passageway located in the pericardial cavity, present over the posterior aspect of the left atrium. Whereas transverse sinus is the part of the pericardial cavity forming a transverse passageway between two sets of great vessels, anteriorly pulmonary trunk and aorta, and posteriorly we have superior vena cava and pulmonary veins. These passageways are very important, particularly the transverse sinus here, because it provides surgical approach to surgeons through which the surgeons during the surgery on the heart can reach the great vessels. So I hope this clinical significance of these sinuses is clear. Blood supply of the pericardium. This is again an important topic related with the pericardium that is commonly asked in the MCQs during the examination, written paper. So pericardium is supplied by the branches of internal thoracic artery, pericardiophrenic, musculophrenic, inferior phrenic arteries, and the thoracic aorta. Musculophrenic artery is basically a terminal branch of the internal thoracic artery. And pericardiophrenic artery is also one of the branches of the internal thoracic artery. Whereas thoracic aorta also gives off various branches to supply the pericardium. And those branches include bronchial, esophageal, and superior phrenic arteries. Fine, superior phrenic artery also and inferior phrenic artery as well. The veins from the pericardium drain into the azygous system of veins, internal thoracic veins, and superior phrenic veins. Nerve supply of pericardium. बेटे nerve supply of pericardium जो है is a very important topic when it comes to SAQs given on the nerve supply of pericardium. So the nerve supply of pericardium involves the nerve supply to fibrous pericardium as well as parietal layer of the serous pericardium, and then the visceral layer of the serous pericardium has a separate nerve supply other than the fibrous and parietal layers. So fibrous pericardium and parietal layer receive their sensory nerve supply from the phrenic nerves, the nerve to the diaphragm. Whereas the visceral layer of the serous pericardium receives the nerve supply that provides neuronal supply to the heart, that is autonomic nervous system comprising of sympathetic and parasympathetic parts. So the sympathetic contribution arises from the sympathetic chains that are located parallel to vertebral column on both sides of the body, right and left, and vagus nerves. Vagus nerve is basically the 10th cranial nerve, carrying the parasympathetic component as well. So I hope the nerve supply to pericardium is clear.